Hello, I'm Dr. Fred Venditti. I'm the Hospital System General Director here at Albany Medical Center. I'm joined today by Dr. Dan Pausé, our Chief Medical Officer, to bring you the update from Albany Med. The first slide is the usual slide that we always show you, which has the count of patients in hospital across the region. And you can see that the number really hasn't changed. We're at 39 patients in hospital in the Capital District. Really, this has been flat, Dan, for a number of weeks, really going back almost 2 full months. The second slide up is the census today here at Albany Medical Center. We have 14 inpatients, 13 of them are on the floor. One of them is in an ICU, but not on a ventilator, and that's a pretty remarkable circumstance as well. Dan, it's been quite some time since we've had more than 20 patients in the hospital,
yeah,
right?
Fred, I think it's been since mid-June that we've had more than 20 patients.
So we're really at status quo. We're just kind of floating at this same level. The last slide also is familiar to you. This shows the admissions and discharges, and you can see that those numbers remain relatively small, a few in, a few out over the last couple of days, basically keeping us in the low teens. Dan, we talked on Tuesday, Dr. McKenna and I, about visitation. We've put out some new guidelines on visitation. I think there's an aspect of that you found very helpful. Can you tell us about that?
Yeah, I think one of the things that's been very helpful to clarify amongst the staff here is to be consistent as much as possible. And one of the ways in which we can do that is if there is a request for an exception or visitation outside of regular visitor hours or outside of regular rules, then the process is to contact the charge nurse or the nurse manager on the floor to make sure we can go through the appropriate steps to make sure that visitation can happen.
That's great. You know, we're trying to make it more straightforward and clear on how people can come in and visit their loved ones. We think it's important, but we want to do it safely. So this is good that we've clarified and have involved some of the nurse leadership in it. So I introduced Dan as our Chief Medical Officer, and I asked Dan if he would tell us a little bit about what is the Chief Medical Officer? What's your role and responsibilities here at the Medical Center?
Sure. Well, I've been a part of the Office of Medical Affairs for about 7 years now. The last 2 I've taken over for Dr. McKenna as Chief Medical Officer. The office itself is responsible for a number of different things, mostly as to how the medical staff operates following the bylaws, the credentialing, also establishing committees and making sure we're following bylaws and things like that. But we also have a number of different departments that now report up through the Office of Medical Affairs, which I'd love to talk about because I think we have some just phenomenal people that do some great things. I think just to list the groups that we have case management. That's led by Mitchell Todd, which does an outstanding job. He's really transformed the department.
He has.
They're responsible for the coordination of care, discharge planning, things like that throughout the institution. So Mitch and his team are just phenomenal, have done a great job. We have epidemiology. Epidemiology is led by Rebecca O'Donnell. As many of you have
we've talked about them a lot.
Talked with Epi, and throughout this whole pandemic, they have worked tirelessly to keep our staff and our patients safe and have done just a great job there. We have clinical documentation improvement even. So clinical documentation improvement or integrity is led by Dr. Ashley Taliski. She's one of our associate medical directors, and Esther Brown, and they make sure that our documentation is accurately reflecting the complexity of care that we provide here. As you know, we provide the most complex care in the region of anyone, and it's really a remarkable job of what they do. Just some other departments that we have which also do just a phenomenal job. Employee health, that's led by Karen Lovell, which again, very busy over the last several months and do a great job making sure we're fit tested and have all that equipment that we need that appropriately fits, etc. Credentialing. Susan Spano leads our credentialing department. One of the cool things that we've been able to do through credentialing is credentialing on a system level. So now we've gotten together with our hospital affiliates, Saratoga and Columbia Memorial, and soon to be Glens Falls, to credential as a system so our providers can go through as one system.
Makes it easier for the providers.
Easier for the providers. Now it's all electronic. We're on a good path there. Pretty neat. And then two of our newest departments are Joint Commission Readiness. That's led by the phenomenal Pam Jones. As you all know, we were certified last year by the Joint Commission for another 3-year certification, which is the maximum you can get, with, I think, one of the most impressive kind of performances we've had.
I think it was one of the best we've had going back 15 years.
15 years, wow.
Yes,
so
absolutely.
Really remarkable. This year we're kind of set up for the heart failure as well as stroke certification. So while we have a full certification 3 years away, we still have a couple of different
every year we have
certifications.
something going on like that, right, Dan?
Absolutely,
Yeah.
absolutely. This year it's those two. And then last but certainly not least is our quality management department.
Very good.
So quality is led by our Associate Medical Director, Dr. Patrick McNulty, who's an interventional cardiologist, and Dr. Megan Keenan. And they just do a phenomenal job making sure that we practice as safe as possible with as much quality as possible, always looking to improve, involved with a number of different national registries and databases to mine that data, to bring it into our system, to look for quality improvement possibilities and kind of move us forward.
So the medical director's office, the chief medical officer, is responsible for a lot of important functions here at the medical center. And Dan does a terrific job. He learned from the master, his predecessor, Dr. McKenna, but a very important role, some very important functions here. So thank you, Dan, for that.
Thank you.
Just a few more things before we end today. We had talked about the picnic on Tuesday. Well, yesterday we had the first of 3 picnics for employees here at the medical center, and we handed out over 2,000
Wow.
meals. So a number of us were out there. You were out there, Dr. McKenna, myself, a number of folks handing out meals. I think it was very well received, and most importantly, the rain held off.
Yeah.
So none of us got wet. So that's something that I just wanted to highlight. And then I thought I'd finish with some facts about the medical center. I don't know if our viewers out there read Dr. McKenna's letter last week, but it had some very interesting facts about the medical center that I thought we would highlight. So Dan, we're the size of a small country, aren't we?
That's what I hear.
That's absolutely true. So the medical center has 4.2 million square feet of space under roof, which is just a little bit smaller than a country called
Vatican City, yeah.
Vatican City, yes. But there are a bunch of other interesting facts that are out there. We have 1,000 toilets.
Did not know that.
We have 7,400 doors. We have 6,000 fire alarms within the organization. 82 elevators, which we do know because we hear about them when they're not working at the safety brief. And we have 2,100 sinks. All of that gets managed by a couple of groups, right? So the facilities folks, when stuff gets broken, and our EVS folks clean all this space.
Outstanding.
And all this stuff. So shout out to both facilities and EVS. You're doing a great job in this very large facility or relatively small country, depending on how you want to categorize it. So I think that's it today here from Albany Medical Center. Look forward to talking to you next week. Dr. McKenna actually will be without me next week as I will be on vacation, but he has a power-packed lineup of individuals to replace me. So with that, take care of yourself and take care of each other. Here from Albany Med.